Now we want to look at two things on this side of the model. On this side over here, we want to look at the nephron. That's actually what makes the urine. And then we want to look at the blood supply to the nephron. Let me get that nasty tag out of there. So, then let's look at the parts of the nephron first. There are 5 parts of the nephron. And we'll look at this part even closer in a minute because we got a model that shows it really big. You saw in the previous video, this would be an interlobular artery. And no, let's not go there yet. That's the blood supply. I'm talking about the nephron. The nephron is all the white stuff. The blood supply, here's another tag. Isn't this fun? That's left over from old practicals. And we're going to talk about what those tags were on. Gotta have fun with it. Gotta have some fun. The nephron are the white parts, okay? And the blood supply are the red and blue parts. So let's talk about the nephron first. Let's not go to the blood yet. This is called Bowman's capsule, okay? And then next to the Bowman's capsule, you're familiar with this term, is the proximal tubule. The old name for it was the proximal convoluted tubule because it got convolutions in it. That's what convolutions mean, that it's wavy like that. Okay? So the Bowman's capsule, the proximal tubule. Now you have to be careful in this model because there's a crossing right here of that one with this one. That's going to be the distal tubule, but it crosses over the proximal tubule. So this is more proximal tubule down here. Then we come, that's part 2. The Bowman's capsule 1, proximal tubule 2. Then this is the loop of Henle. The loop of Henle goes down into the medulla. There are juxtamedullary nephrons where it goes way down into the medulla. Most of the nephrons, though, are cortical nephrons. They're in the cortex. This is the descending limb of the loop of Henle. This is the ascending limb. And then we come up here to the distal tubule. Remember I said there's a crossing right there, so that's all distal tubule. And then the distal tubule runs into the collecting duct. Remember, the collecting duct will go into the minor calyces, into the major calyces, into the renal pelvis, which funnels it into the ureter, which takes it down to the bladder, where it's held until it's voided. So the white parts are the nephron itself, and there's hundreds of thousands of these in each kidney. The estimate is 500 to 750,000. You'll read variable estimates. And there are 5 parts to the nephron. The Bowman's capsule, that C-shaped thing, the proximal tubule, the loop of Henle, the distal tubule crosses over here and comes down to the collecting duct. 1, 2, 3, 4, 5. Bowman's capsule, proximal tubule, loop of Henle, distal tubule, collecting duct. Now the second thing we want to look on this model is the blood supply. And I've already started it once, so now I'm going to start it for real. This is called the interlobular artery. It's one of many branches off of that started out with one artery going into the kidney, the renal artery. Okay. This is the afferent arteriole, which is running into the Bowman's capsule, and it forms a ball of capillaries there. And that ball of capillaries is called the glomerulus. And that's where the filtration goes on. But that's not the only step in urine formation. It's just the first step. Okay? If you say, I know what the kidneys do, they filter, you get 33%. Yeah, because there's two more important processes. One of them is subdivided into two. So you really ought to get 25% if you know the kidneys filter, 25%. That's just the first part of it. Then this going out is the efferent with an E. That's the afferent arterial. This is the efferent arterial. Okay. And then the efferent arterial comes over here and it branches all over the place into what we call peritubular arteries. P-E-R-I tubular. T-U-B-U-L-A-R. Peritubular arteries. Then there are peritubular veins, which then drain back into the interlobular vein. Now those are not parts of the nephron. They're the blood supply to the nephron. The parts of the nephron, if you're asked on a test, are Bowman's capsule, proximal tubule, loop of Henle, distal tubule, and collecting duct. If you start saying interlobular artery, that's not part of the nephron. It's part of the blood supply to the nephron. Let's look at it again. This is an interlobular artery. That is an afferent with an A, arterial. This is the what? The glomerulus, see? Then this is the efferent arterial with an E, and then that branches into the what? The peritubular, I said arteries before, they're capillaries, but they're arterial capillaries, okay? And then there's also then the peritubular capillaries, which are like veins that are draining the blood out of it, and then they go into the interlobular vein. So this model shows us two things: the parts of the nephron, Bowman's capsule, proximal tubule, loop of Henle, distal tubule, collecting duct. That's the nephron. And then the blood supply is what? Interlobular artery, afferent arterial, glomerulus, efferent arterial, peritubular capillaries, both arterial and venule, and then draining back into the interlobular vein. There's a term that they use for the combination of the glomerulus and the Bowman's capsule together, because they're almost like one thing, and they call that the renal corpuscle. The renal corpuscle is the glomerulus plus the Bowman's capsule. So now you see the functional unit, the unit that really makes urine in the kidney, which is called the what? The nephron, and then you see the blood supply to the nephron. Now we have one more video on the renal system, the urinary system, the excretory system, and that is about a close-up look at the glomerulus, Bowman's capsule, renal corpuscle.